The proximal and distal attachments for the sternocleidomastoid are
Mastoid process and the nuchal line on the occipital bone.
okay.
Distal attachment is going to be the manubrium of the sternum. And then
Has a clavicular head.
clavicular head, sternum.
So the clavicular head, obviously, to the clavicle. Okay. So when we palpate, there's two main techniques that we use to palpate when we're examining a muscle. One's going to be what we call a pincer palpation, and one's what we call flat palpation. Okay. So pincer, you're kind of doing this, and you're going to lift the tissue and kind of snap across the fibers because you want to examine that tissue. Okay. And you can change your depths. I can be more superficial, or I can go a little bit deeper as I snap across the fibers. Okay. Flat palpation is when I'm, again, examining that tissue and going across in a flat manner, okay?
What was the first term you used?
Pincer.
Pincer.
So it all depends on the muscle, okay? So, you want to take
Yay, Caleb, bro.
So, all right.
My guys
What
been
else
working
did you
out.
learn about confirming that you're on a muscle, specific muscle?
Make them do the action.
Make them do the action, right? So we think about the attachment to that muscle, right? So this is one of the bony prominence you need to palpate is the mastoid process, okay? Right, it's a very prominent, so we brought, this is the way you should study, by the way, this is where we brought these things. You should have your study, your visual aids. There's the mastoid process, it's important, okay? So that's the proximal attachment. It's a round surface, so I should be able to feel that protuberance, okay? Right, so that's the proximal area. When we test a muscle, by the way, we're gonna test it in its entirety, okay? So what are the actions for the sternocleidomastoid?
Ipsilateral, lateral flexion, and contralateral rotation.
Okay, anything else?
Bilateral cervical flexion.
So cervical flexion. And what about for the head? Does it flex the head?
Yes.
No, extends.
Extends.
Okay, so this is SCM, okay? Head extension, cervical flexion, okay? You guys had deeper muscles, longest coli, longest capitis that you cannot palpate. That is head flexion, cervical flexion, okay? The easiest way to confirm and activate the SCM is going to be to rotate the head to the opposite side. So can I have you do that motion for me like that?
Mm-hmm.
Okay? And it does that, I can see the muscle, right? I can see its borders, the anterior border, posterior border, okay? So now I can examine that muscle. So I can use pincer grip palpation. I'm gonna just snap across those fibers, okay? You can relax now, you know that I'm on it. Okay? And I can just snap across those fibers, right? So you can see from the other view, it looks like that. Just snapping across those fibers, right? How's that feel? Any pain, any tenderness?
Super tender.
Super tender. Where is it? Here?
No, higher.
Okay.
Yeah.
There?
Mm-hmm.
And what about here?
Mm-hmm.
Worse here or worse here?
Worse there.
All right. Okay. So I'm feeling more tension there, and he's feeling. Okay. So by the way, that might be the way that we identify. Was the whole muscle sore or only a spot in the muscle? Right. And I felt it taut there. Okay. So it's a taut band under my fingers, and it reproduces pain. Now, do you have any neck pain normally or currently?
No, shoulder pain though.
Okay. Does that reproduce your shoulder pain? Okay, so this is just like a latent trigger point. Okay, so got some information. All right. So there is your SCM palpation. So when we palpate, make sure you go all the way through the muscle. Right? Don't just confirm the muscle. That's all you did. You didn't actually palpate it. And palpation is examination by hand. Okay. The next muscle on the list is the scalene muscle, and we have 3 muscles. Okay, so let's look at the model again. Okay. So here's the SCM, right? Here's the trapezius. We have a little window to palpate the anterior middle scalene there, okay? This muscle here is your Splenius capitis, and that's your levator. And this is the upper trap, okay? So we call this the posterior triangle, okay? So, okay. So let's use that now, okay? So it's in the root of the neck where we can more easily palpate it. I still have to identify that sternocleidomastoid, and I have to go just posterior to the sternocleidomastoid, okay? I'm gonna take off your clothes.
Timu.
That's crazy.
Bro exposed himself.
Okay? All right, so the SCM, they're flat muscles. they're deeper, we can't get that pincer palpation. So we're gonna do flat palpation, okay? So just posterior to the border of the sternocleidomastoid, I can palpate the anterior scalene, okay? So there's your anterior scalene. Do you guys remember what's between the anterior and middle scalene?
Jugular? No.
Your brachial plexus goes through there, and your subclavian artery, okay? So this right here, by the way, you're gonna get a pulse, because that's your subclavian artery, okay? So the anterior scalene, I'm gonna assess it here, just posterior to the SCM. Then I'm gonna do middle scalene right here, right? So about a finger breadth lateral. There's your posterior scalene, flat palpation. Okay. What is the insertion for these scalene muscles?
The transverse
Give me the
processes-
proximal attachment, I should say, sorry.
on the transverse processes.
Transverse processes of,
Like C3 through
C3 through 7.
I think
C3, 4, and then
It's different for
C4,
each one of
C7.
yeah, so various, okay?
Yeah.
So you're making your way towards the transverse process. His head is rotated to the left. As I poke here, I'm feeling something bony. That is transverse processes, right? But they're just now facing that way, right? So I'm tracing that muscle down to the transverse process, okay? Kind of assessing it like that, right? So anterior, middle, okay? The posterior is a little bit harder to get, so what I want to do is I want to find the upper trapezius now, okay? So here's his upper trap. I can confirm that I'm on it. Can you go ahead and just push your shoulder into my hand? Okay, there's the trapezius muscle there, right? So here's the anterior border of it, right? I'm also doing a pincer grip palpation. I can do pincer grip for the trapezius muscle, okay? So I'm in that lateral triangle, lateral region or posterior triangle, and now I'm, again, anterior scalene, middle scalene, and the posterior scalene is going to be in this region. So I'm going to do flat palpation and make my way towards the transverse processes there, right? So that little bony region I'm going to feel, okay? So that's how you palpate those muscles, okay? We got pincer for sternocleidomastoid. We can do pincer palpation either this way, or you can turn and go the other way. By the way, I can do upper trap and prone as well, okay? All right, so we just covered, Dr. Romero, can you get the screen? It went blank. Okay, so we covered levators, sternocleidomastoid, the scalenes, and the trapezius. Okay. In this region here too, we can palpate the Splenius capitis. So we have a window for the Splenius capitis. Okay. So again, here's my landmarks. There's the sternocleidomastoid. There's the upper trap, anterior, middle, posterior scalene. Posterior scalene is not on here. We have a levator scapula and Splenius capitis.
Can you show it this way? Sorry.
Yeah.
Okay, Splenius capitis,
Mm-hmm.
levator,
Mm-hmm.
middle, anterior scalene, SCM. Okay, this is semispinalis capitis. Okay, all right. So if I turn his head to the side again, here's SCM, here's upper trap. There's my window, right? In this region, going towards the head. Again, if you can see this, there's a muscle that's going like that. Okay, so that's what I'm going to palpate right here. Okay, so flat palpation, I can palpate going towards the head or going towards the occiput for the Splenius capitis. Okay, flat palpation, going across. Any tenderness with that?
No, a little, but not so much.
All right, so we had two options of, again, pincer grip palpation, and we had four muscles that we use a flat palpation. Go ahead and prone now.
So that was just posterior to the SCM?
I tied
Posterior to the
Yeah.
Efficient.
Yeah, that kind of bad.
I tied it. So,
You. That brings.
Well secure.
himself.
I was like, it's fine, I got it.
Give him a snorkel.
Thought the same thing.
It's a straw. Put your head down. Poke a straw through the.
It's
Through
strong
the.
enough, it's okay.
That's
All experience, top-notch service.
Let's get that low back here.
I like the little rocks, but
The hot rocks.
Okay. So same thing. We have a different now opportunity to palpate some other muscles or some of the same muscles in a different manner. So for example, trapezius is still here, right? So here's again, I can do a pincer grip palpation of the trapezius. I'm standing. If I sit down, then I can turn my hands if I prefer that, right? So this is another way to kind of win that. So how does this feel right there, right? I felt that, he felt that, right? We felt it differently though. Okay? So I felt the top band, right? So you see like the pliability. Remember, when you're palpating muscle, one of the things I want you to think about is like, what should it feel like? Most of these muscles should be pretty pliable, right? So it's nice and pliable, nice and pliable. And also when I got here, and that's like a spot that was popped, okay? Does that reproduce pain? Okay. Is that pain familiar to you, or is that something just kind of like that hurts right now that I touched it? Does that reproduce any of your familiar symptoms?
Not for the shoulder pain,
Not for
but
sure.
it's been messed with before.
Gotcha. Have you had a history of neck issues, neck pain or anything like that?
No, but I have rounded shoulders.
Okay. So we can palpate that, by the way, as a flat palpation almost to the occiput, and then you kind of lose it, and you can then go all the way to this nuchal line. Okay? So that's upper trap. That Splenius capitis is going to be just anterior to it. Okay? So where's that model there? Okay, right? So now if we're like this, right? That's trapezius. Just like that is Splenius capitis and semispinalis capitis. Okay? These extend the neck as well, so that might be a good way to confirm them. All right? So for example, if that's the trapezius and I'm going just lateral to it, I'm in this region right here. Okay? So the more midline muscle is going to be the semispinalis capitis, and the little bit more lateral is going to be splenius capitis. Running like that, running like that, okay? So I'm here. Can you go ahead and extend your head up a little bit? Okay, back off. All right, so now I'm examining splenius capitis. Do that again for me. We can see splenius capitis there, right? Relax. And I can examine splenius capitis, flat palpation, okay? This doesn't feel good, right? Okay, land your back again. You guys got that? Okay. So I think now we have the suboccipital muscles. Wait, do we have levator on the list as well?
Yeah.
Yeah.
Okay, sorry, okay. Levator scapula. Give me the proximal and distal attachments of the levator scapula. Transverse processes of?
C1 to C4.
C1 to C4, okay? And distal?
Spine of the scapula.
Superior angle of the scapula, okay? So let's do that. Here's his scapula, okay? Inferior angle. Here's the medial border, okay? Here's the spine of the scapula. Okay. There is a superior angle of the scapula, okay? Superior angle, by the way, lines up with T2. So these are some of the bony prominences, right?
Yeah.
Inferior angle should line up with T7, okay? Ish, right? Okay. So anyways, so we go back, there's our superior angle, and it's going towards the transverse processes of these upper 4-ish segments, okay? So there is transverse process here laterally, okay? So that, why do I want to know that? Because that's the direction that I'm going to trace the muscle, okay? So I know it's proximal distal attachments. Now I can kind of think about how I'm going to kind of get there, okay? So what action does the levator scapula do? Elevate the scapula, right? So if I'm in that region now, then I can have them just go ahead and push up. Sorry, shrug your shoulder. Good, relax. And I've identified the levator scapula there, all right? And I can start to palpate that muscle, and I'm making my way towards the transverse processes. Okay? All right. See how his neck goes down? Like that. Okay? So make sure that we put him in a good position. He had that crease, and I had a small window. Now I've increased my window there, right? So tracing it down like that. Okay?
Isn't it like deep to the trapezius where you're still like?
So there's a window where there's not here, and then it is deep to a couple muscles. Okay? A lot of palpation, you're deep to another muscle, so you just need to pay attention to that fiber orientation. Okay? And you might or may not be on. Okay? Yeah, so lastly is suboccipitals. Go ahead on your back. So suboccipitals, we could have done them in prone, but they're better appreciated in supine. Okay, so you're not visualizing it, but you're feeling it. Okay, so let's think about what are the attachments for suboccipitals? Someone can read them out to me.
Let's see, get my computer.
Hey,
This is
somebody
why we
got
created
Right
that.
behind us. Oh, Albert has it.
Transverse and spinous process of atlas should be atlas and axis. Occipital.
This palpation gives me a headache.
Rectus, capitis, posterior major, spinous process C2, and the occipital.
Albert, I can't hear you.
Yeah.
Get the mic.
Everybody gotta stop talking.
For rectus, capitis, posterior major, it's spinous process of C2, and then the occipital line of the occipital bone.
Okay, what other landmarks am I looking for the other muscles? So I got C2 spinous process,
The transverse process of C1.
transverse process C1, and what nuchal lines?
The occipital.
Any other
Superior?
resource?
Are you still doing the rectus, capitis, posterior major?
Give me all of them.
No,
Just
all of
we're
them.
just looking at
What I,
it.
The whole
what I got from the
suboccipital.
book was spinous process, like proximal was axis and spinous process. Distal was occiput inferior nuchal line laterally. That was for that one. And for rectus, capitis, posterior minor, proximal was the atlas tubercle, posterior arc. And distally was the occiput inferior nuchal line medially.
So these are probably best appreciated if we put the skull on the model, but one thing I want you guys to think about. So when you palpate the back of the head, you can feel something called the occipital protuberance, okay, right? The external occipital protuberance. So you easily feel it, right? If I go just lateral to those, I'm gonna be in the superior nuchal line, okay? So I go lateral to it, superior nuchal line, right? See that line there? Okay. If I drop about a finger breadth and from there, then I'm gonna be in the inferior nuchal lines going that way. Okay? So these are the attachments for, again, upper trapezius and these suboccipital muscles proximally. Then distally, we're gonna have the first spinous process C2, and then we're gonna have them move laterally towards C1 to those posterior tubercles, okay? So those are the bony structures that's the region that I'm palpating, right? How do we do that? This is why it's better to be in supine, for a couple of reasons. One is that the muscles, you can shorten them a little bit so you can get some more depth, okay? So when the head's down, the head is flexed, you've lengthened those muscles, and they're a little bit tauter, right? So it's hard to get depth, okay? These muscles are deep. So if I want to show you suboccipitals, I got to reflect back the trapezius. I got to reflect back the splenius capitis, semispinalis capitis, and then I can show you the suboccipitals, right? So that we need to get deep. So what we're going to do is, my hands are like this, and they're resting on the table. I'm going to cradle the occiput. I'm going to try to get in that space between the occiput and C1, C2. I'm in that region, and I'm going to scan these more medial muscles and these more lateral suboccipitals, right? So we're here, nice and relaxed. And I'm going to just go side to side. So it's a flat palpation. I'm strumming across and getting depth. Okay, how does that feel? How's this side? How's this side?
That side's worse.
Okay, so you have some tenderness on this side?
Mm-hmm.
Okay. All right, so there. Okay, so that's how we do it. Okay, so you could do it in prone, but here I can actually get him in a shortened position, nice and relaxed, and get that depth. My hands are soft. I'm staying relaxed. So they're resting on here. I'm just kind of pushing up, and I'm doing that just to scan or examine that area. Okay? All right, we're gonna take about 7 minutes apiece for palpation. 7 minutes apiece. Maybe you're not gonna be able to do them all, okay? But this is not the only place you practice. I want to make that clear. This is why we have these logs. Like, we're showing you how to set up the practice, but it's on you to practice, and we're gonna hold you accountable to do it. Got it? All right, break.
Break.